I'm not scared of getting sick at work because I can do a risk assessment, I can interview a patient, I can take specific precautions and wear the appropriate PPE and be safe. I'm not worried at work.
I actually did test positive for COVID.
I'm scared of getting sick because I know I'm one of the few in the province that has the knowledge to be able to take care of the sick.
I am definitely scared of getting sick because I think there's so many stories of young people, and I hope to consider myself still a young person um, who have passed away from this or have been left with a very devastating, long-lasting effect. And sometimes when you know more about the disease and you treat it, you tend to respect it more and be scared of it at times.
Well, I think my fear is mostly community spread. I find I feel very safe at work. Uh, it's I have more control over my environment in the ambulance versus the community where going grocery shopping or going to Costco even, and you got to make those runs. You got to fill your fridge, and I feel that's where I feel the most nervous, I guess, about getting COVID.
I know it wasn't from work. Um, I know it was when I was out with my friend for her birthday. We were in a building where no one was wearing masks. However, they were only allowing a certain amount of people in. There was strict rules. They had to check your temperatures. You could only have like 6 people to like a booth, and no one was standing around on like dance floors and stuff like that.
Where I have worries is out in the community. And so I do all I can to limit my time out and about. I stay home, I connect socially with friends through virtual means, and I limit my errands because the COVID is everywhere. It's in our community. We know that where people are most at risk is probably in those areas where they feel most comfortable. And you're more likely to catch COVID from a family member, from a friend, from a close contact in a break room. It's when you let your guard down.
So if I'm sick, I'm one less body in the hospital. I'm one less body with my coworkers. That's what scares me.
There's not a pleasant way to describe it. Being on life support, losing a lot of the dignity that comes with being laying on a bed on life support, losing, having discomfort, pain. Uh, these are not pleasant things that anybody wants to go through, but certainly not someone like me who knows what that actually feels like, who knows what that actually means.
I think my fears are mostly just I don't want to get anyone else sick if I were to get it. I think that's my biggest thing. Um, so I've limited my close contacts and things like that, and I would hate to bring it home and get anyone else sick. But I've definitely taken all the precautions. I've been wearing a mask kind of basically since summer, and I found that I just keep my distance. I'm a little bit of a hermit anyway, so it doesn't really bother me to kind of stay indoors. So um, hasn't been too much of a change that way. I miss the occasional going out with friends, but like I said, we find out ways to connect that way. So no, I'm not really too nervous about getting it, but it's definitely something that's always kind of in the back of your mind for sure.
And Monday morning, I checked my results online with the My Sask Health records, and it showed that I was positive for COVID. And my heart just sank. I was almost in like a panic mode, called my manager saying it's positive. I had to speak with the director of critical care and explain to him like how this happened, and was trying to answer all the questions that he had to the best of my possibility, because I had gone to work after I had gone out. I didn't know if I put a bunch of other people at risk, whether it's patients or my coworkers. And that really worried me. And then my grandpa and his brother, I had to call my grandpa. I said, "You need to go get tested. Like, I'm positive for COVID. Please go get tested. And you gotta stay home." It was a bit of a panic for me. And I didn't really care so much about myself because I felt fine, but it was more of the fact that I could have infected other people.
I don't think that fear should ever paralyze us from living our life. And so I try to be more, less fear and more respect of the disease rather than just be like paralyzed by the fear of the disease. But you know, every single time I interact with a COVID patient, when I'm undressing from the personal protection equipment, that thought crosses my mind. Did I, by any chance, somehow get it now? And you know, luckily these moments are very short-lived, and I just move on. But I think it's on our mind. It's on all of us. I don't think I'm unique. I think all of us, when we get in the elevator or we walk into the door or something, we think, especially if we didn't take the precautions 100%, you think, and even if you do, you still question and wonder. And so I try not to let it paralyze me, but certainly it's always on my mind.
My new normal is that my life is become quite small in terms of what I'm doing. So I'm not scared of getting sick, but I do everything I can to prevent myself from getting sick because I don't want to be part of spreading this to others.